Hello guys, so now we shall be discussing regarding the cranial foramina. Okay, what are the different kinds of foramens we have got within the cranial part? So we will discuss about the cranial foramina. Now coming to this cranial part or the cranial foramina, what are the different cranial foramina we have got? First important thing you have to know is that, let me draw the part of the face from the lateral side. In this way. Now here you have got a cranial fossa called as anterior cranial fossa. This is called as middle cranial fossa and posterior cranial fossa. All of you know posterior cranial fossa is having an opening like this, right? So this entire thing which I have drawn right now is called as your skull vault. Okay. Now what we shall do is that there are some openings within the anterior cranial fossa, middle cranial fossa and posterior cranial fossa. So what are these openings? Those openings are nothing but called as your cranial foramina. So what we shall do is that let us first write it down, that what are these three important things. This is your anterior cranial fossa, anterior cranial fossa. Next, this one is your middle cranial fossa. Next, this is your posterior cranial fossa, posterior cranial fossa. Okay. So let us discuss about these cranial fossa, right? The first important picture which you can see over here right now, right? So this entire thing is your anterior cranial fossa. After that, this particular part is called as your posterior cranial fossa. See, this is your anterior cranial fossa, this is your posterior cranial fossa, this is your middle cranial fossa, anterior cranial fossa, middle cranial fossa and posterior cranial fossa. These are the three cranial fossas which you have. And within this cranial fossas you see the openings. Now by looking at the picture, just tell me where the maximum openings are there, in the anterior cranial fossa or middle or posterior. Anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Maximum number of openings are present in the middle cranial fossa. And posterior cranial fossa has got larger opening, right? So these are the things which you know. Let us discuss one by one. This particular bone which you can see in the center like this, right? This particular bone, this is called as your ethmoid bone. Okay, this bone is called as your ethmoid bone. Ethmoid bone. Okay, so actually this is how the ethmoid bone looks. So this is the ethmoid bone. On either side of the ethmoid bone, whatever things you have got are called as the plates. Okay, these two things on either side of the ethmoid bone are called as a cribriform plate. So even cribriform plates are also included in ethmoid bone. Cribriform plates are also the part of the ethmoid bone. But important thing you need to know here is that within this cribriform plates there are some openings. Okay, there are some openings like this. These openings are nothing but called as, what are these openings? These openings are called as your olfactory foramina. Okay, what are these openings called? These openings are called as olfactory foramina, right? Not only olfactory foramina, in the front here you have got a larger opening, on the back also there is larger opening. Here also you have got a larger opening on the front and larger opening on the back. So this opening on the front which you can see over here is called as anterior ethmoid foramen, anterior ethmoid foramen, and this one over here is called as your posterior ethmoid foramen. Okay, so there are three important openings over here. You cannot see all these structures over here because there are no openings. These tiny openings are called as olfactory foramina, right? And next we have got anterior ethmoid foramen, posterior ethmoid foramen. From the anterior ethmoid foramen, anterior ethmoidal artery and vein will pass. Posterior ethmoidal foramen is within this, posterior ethmoidal artery and vein will pass. Okay, and not only that, through this olfactory foramina what will pass? Your cranial nerve number 1. Cranial nerve number 1 will pass. What is cranial nerve number 1? That is your olfactory nerve. What is this cranial nerve number 1? That is your olfactory nerve. So olfactory nerve will pass through this. Okay, and second important thing is that If you look here, right, so there is one more important and interesting structure which you can see exactly here. Within this anterior cranial fossa only, you can see one more interesting structure. So this is that particular structure like this. So this particular structure which you can see in the anterior cranial fossa, this is what is called as your optic canal. So through this optic canal, which nerve will pass? Optic nerve, right? So this particular canal over here is called as your optic canal. So through this optic canal, which nerve will pass? That is a optic nerve. These are called as optic nerves. So one very important thing you need to know, that in the anterior cranial fossa, what are the things that are present? Anterior cranial fossa, we have got a bone called as ethmoid bone. In this ethmoid bone, you have got two important foramens, anterior ethmoid foramen, posterior ethmoid foramen. Next, you even have got foramina. These are called as olfactory foramina. Next, these plates here, both the plates, see, this is one plate, this is one plate. These plates are called as cribriform plates. Okay. So what are these two plates over here called as? They are called as cribriform plate. Cribriform plate. Right? What are the things that are passing over here? One is called as the cranial nerve nuclei number 1, that is your olfactory nerve, and next you have got from anterior ethmoid foramen, anterior ethmoid artery and vein is passing. We will write down all these things, okay? In a table we will write it down. Posterior ethmoid foramen, posterior ethmoid artery as well as posterior ethmoid nerve is passing. Right, now when it comes to another important thing, what is another important thing you can see regarding the middle cranial fossa? Regarding this middle cranial fossa, what are the different structures we have got within this middle cranial fossa? Right, so first important structure over here is that you see an opening here, right? So this particular opening over here is called as supraorbital fissure. This is called as supraorbital fissure. Okay, so this opening is called as supraorbital fissure. After that, you see another opening here, right? You see this particular opening which you can see over here, on here and here, right? So these two openings which you can see over here is nothing but called as foramen rotundum. Foramen rotundum. This is called as foramen rotundum. Okay, just beneath this foramen rotundum, you see this particular foramen over here. This is the foramen is oval shaped. So this is called as foramen ovale. Okay, so this one over here is called as your foramen ovale. Foramen ovale. And after that, you see a very tiny small foramen here. This tiny small foramen is called as foramen spinosum. Foramen spinosum. Okay, and lastly we have got one foramen which is in the form of a lacerated shape, right, a torn away shape, right? So this is called as foramen lacerum. Foramen lacerum. So what are the different foramens which you can see? One foramen on the top we started was supraorbital fissure. Another one is called as your foramen rotundum, which is rounded in shape. Next you have got oval shaped foramen called as foramen ovale. Next you have got foramen spinosum, and lacerated shape is called as foramen lacerum. If you look at the supraorbital fissure, within this supraorbital fissure you have got very important cranial nerves. Okay, for example, cranial nerve number 3 is passing through this supraorbital fissure. Cranial nerve number 4 is passing through this. Next, cranial nerve number 5 is passing through this. I will go into detail about this. Next, cranial nerve number 6. So, what are the numericals over here? 3, 4, 5 and 6. What is the third pair of cranial nerve? Third pair of cranial nerve is called as your oculomotor nerve. Oculomotor nerve. Fourth pair of cranial nerve is called as your trochlear nerve. Trochlear nerve. Fifth pair of cranial nerve over here is called as, within the fifth pair of cranial nerve, you see fifth pair of cranial nerve is basically called as your trigeminal nerve. Trigeminal nerve. Now within this trigeminal nerve there are three branches, right? What are those three branches? One is called as ophthalmic branch, which you also call it as V1. Next, there is maxillary branch, which you call it as V2. Next, there is mandibular branch, which you call it as V3. Out of all these three, which is the branch here? That is your ophthalmic branch, not maxillary or mandibular, ophthalmic branch. Okay, ophthalmic branch. After that, the sixth cranial nerve over here is nothing but called as your abducens nerve. Okay, so what are the different cranial nerves over here? Third cranial nerve, right? So third cranial nerve, fourth cranial nerve, ophthalmic branch, and abducens, that is the sixth pair of cranial nerves. So these are the structures that are passing through what? Through the supraorbital fissure. Now after that, the next important thing we have got over here is your foramen rotundum. So through this foramen rotundum, which nerve will pass? See, ophthalmic branch is V1. Through this foramen rotundum, V2 will pass. What is V2? V2 is nothing but your maxillary branch. Okay, V2 is maxillary branch. Next, from foramen ovale, which will pass? That is V3 will pass. What is V3 again? V3 is your mandibular branch. V3 is your mandibular branch. Mandibular branch will pass. Okay. Now, when it comes to foramen spinosum, there are three important structures that are passing through foramen spinosum. What are those three important structures? One is called as an artery, one is called as a vein, another one is called as a nerve. What is that artery? That artery is called as meningeal artery. Vein is called as meningeal vein, and nerve is called as meningeal branch. It is a branch of what? Meningeal branch of V3. What is V3 again? V3 is mandibular. So you are telling that V3 will give a branch called as meningeal branch? Yes. So if you have attended my lectures on the mandibular nerve, which I have discussed previously long ago. So in that lecture on mandibular branch, this is the mandibular branch lecture. In this lecture, you see that the mandibular branch is giving out a branch called as meningeal branch, right? So that is the meningeal branches which I am talking about. Okay, right. So anyways, so these are the branches which you can see over here. Now when it comes to foramen lacerum, this is the part over here. So what are the important foramens which you have here? You have got supraorbital fissure, foramen rotundum, ovale, foramen spinosum, and foramen lacerum. Okay, right. After this, the next important thing we will discuss is the posterior cranial fossa. Within this posterior cranial fossa, what openings do we have? Okay, so here you see this particular opening over here, you see here as well as here, this is like a groove, this is like a meatus, right, an entry. So this particular thing over here is called as your internal acoustic meatus. This is called as your internal acoustic meatus. This is called as your internal acoustic meatus over here. Now after this internal acoustic meatus, you see a J-shaped opening here. J-shaped opening is called as your jugular foramen. This is called as your jugular foramen. Okay. After that, just beneath the jugular foramen, you see another canal-like structure here as well as here. So this canal-like structure which you can see over here is called as hypoglossal canal. Hypoglossal canal. Okay, so this hypoglossal canal, now itself I am telling you, it is having a nerve called as hypoglossal nerve. And the largest and the last important thing, this particular one is called as your foramen magnum. This is called as your foramen magnum. Now within this foramen magnum, there are many important structures that are passing. So what are the different structures that are passing? The first important one is your medulla oblongata. So the reason why I am teaching you fastly is that I have already discussed about this cranial foramina in very much detail in separate cranial fossas. There is a video like anterior cranial fossa. There specifically I discussed about anterior cranial fossa. There is a video about posterior cranial fossa. There in detail I have discussed with the pictures and all. Okay. So I want you to watch that lecture before you watch this. So medulla oblongata. After that, the second important thing is your meninges. Okay, meninges. Third important thing is your vertebral artery. Vertebral artery. After the vertebral artery, the fourth important thing is your spinal accessory nerve. Spinal accessory nerve. Now when I tell spinal accessory nerve, there is ascending part, there is descending part. So this is your ascending part. This is your ascending part. After the spinal accessory nerve, the fifth and the sixth. What is this fifth and the sixth? See, important thing is you need to understand here that there is an artery that is going up like this. Okay, this artery is called right vertebral artery. This artery is called left vertebral artery. The right and left vertebral artery join together to form a basilar artery. Okay, so this one over here is your right vertebral artery. This is left vertebral artery. Together they form what? Together they form basilar artery. Okay, and where is your spinal cord here? This is the exact location of your spinal cord in the center. So from the right vertebral, from the left vertebral artery, you see two branches that are coming like this, right? These two branches are exactly supplying the center of the spinal cord. So this branch which is supplying the center of the spinal cord is what is called as your anterior spinal artery. Anterior spinal artery. The same artery present on the back is called as your posterior spinal artery. Posterior spinal artery. And finally, we even have got something called as dural veins. Dural veins. So these are the structures that are passing through what? Posterior cranial fossa. Now after this, the next important foramen we have got is the jugular foramen. From here also there are quite many structures that are passing. Jugular foramen. So what are the structures that are passing through this jugular foramen? The first important thing over here is your glossopharyngeal nerve. Glossopharyngeal nerve is passing. Second important thing over here is called as your vagus nerve. Third important thing over here is called as your spinal accessory. Just now above I have discussed about the spinal accessory nerve. That spinal accessory nerve here was ascending, right? So the spinal accessory nerve here was ascending and this spinal accessory nerve will be descending. Descending nerve. Next, fourth important thing is your internal jugular vein. Internal jugular vein. Fifth important thing is your inferior petrosal sinus. Inferior petrosal sinus. Okay. And sixth important thing is your sigmoid sinus. Sigmoid sinus. Okay. So these are the 6 important things which you need to know. Okay. So these are some of the important foramens which you can see within the cranial cavity. Okay. And the structures that are passing through this. So this is all you need to know regarding the cranial foramina, guys. So thank you so much for watching my video. Goodbye.